I think it's very important to see, first of all, a reproductive endocrinologist, because if you don't see a reproductive endocrinologist who is a true infertility expert, you're going to be subjected to significant waste of time and possible treatment that are not going to help you achieve a pregnancy, such as simple Clomid cycles, which rarely work unless intrauterine insemination is added to it, and a lot of the regular gynecologists offer it. Very few regular gynecologists have access to intrauterine insemination. So the first thing that you would do is you look for a reproductive endocrinologist, preferably somebody who is board certified in reproductive endocrinology and fertility, but if you cannot find in your location anybody like that, then you would at least look for somebody who had full training in a reproductive endocrine fellowship. And after that, you should try and explore a little further if the physicians at the practice feel as comfortable with surgical treatments as they are with in vitro fertilization. Many practices do not feel comfortable at this stage with surgical approach, and that's why you will have a major advantage by seeking a practice that is comfortable with both approaches. Once you call on an expert clinic, ask them, for example, how many laparoscopies a year they do. A practice that does 5 to 10 a month is probably pretty comfortable with the surgical approach as well. If you do have a tubal factor, or if you have a lot of menstrual cramps and you think you might have endometriosis, you should then ask a little further if the practice does more extensive laparoscopic surgery, such as tubal repair through the laparoscope, if they can remove fibroids through the laparoscope. Fibroids, especially the larger one, definitely could prevent you from getting pregnant. So it's very important to know that the practice you're going to can remove fibroids through the laparoscope and will not have to do a major surgery or laparotomy to remove the fibroids. So those are all questions that you might want to explore before you actually go to the practice to find out that these options are not available.